Good morning, dear medicos. I'm here to discuss with you X-Prep PG CBDT 1, some MCQs in particularly of head neck face region. I'm Dr. Ravindra Marathe. I'm professor in anatomy, teaching the subject since last 30 years. We'll start with our discussion today. Our MCQ number 1 for discussion is displayed on your screen. The question is, identify the thickened nerve marked in the arrow in the image shown below. So in the image, you can see a black colored arrow pointing towards a thickened nerve called as greater auricular nerve. The four choices displayed are greater auricular nerve A, lesser occipital nerve B, facial nerve C, and auriculotemporal nerve D. The nerve identified by us is greater auricular nerve. The thickening of this nerve is clinically important in diabetic and leprotic patients. Right. The nerve thickenings can be palpated in the peripheral nerves such as ulnar nerve and common peroneal nerve also. But this nerve is thickened in leprosy patients. Right. So clinically important nerve. Our choice is A, greater auricular nerve. We have to discuss other probabilities. Why this nerve is greater occipital nerve, greater auricular nerve and not lesser occipital nerve? It is not lesser occipital nerve because the lesser occipital nerve, although it is a branch of cervical plexus, it starts deep to the sternocleidomastoid muscle. Then the choice C is facial nerve. We know that the facial nerve doesn't enter the neck. Only one branch comes to the neck. This nerve enters the substance of parotid gland through the posteromedial aspect, and it can be seen on the face region in the form of the 5 popular branches called as temporal, zygomatic, upper buccal, lower buccal, marginal mandibular and cervical. While the last choice is auriculotemporal nerve. As the name implies, the auriculotemporal nerve is located in front of auricle. It supplies the skin of auricle and the temporal region. Let us continue. The second MCQ reads as, the 55-year-old man develops dysphagia, loss of gag reflex, uvula deviating to the left side and hoarseness of voice. He also has loss of taste in the posterior one-third of the tongue. MRI shows lesions in the medulla, but exact nucleus involved is unclear. The multiple structures are close together. Most likely answer is nucleus solitarius, nucleus ambiguous, dorsal motor nucleus of vagus and hypoglossal nerve in the sequence ABCD. So our answer is nucleus ambiguous. This nucleus, that is nucleus ambiguous, is common to nerve number 9, 10 and 11, that is glossopharyngeal nerve, the vagus nerve and the accessory nerve. The nucleus ambiguous is our correct answer. Why not nucleus solitarius? Nucleus solitarius is concerned with taste fibers. It conducts taste fibers. So defects shown in our choices are dysphagia, hoarseness, loss of gag reflex, uvula deviation, cranial nerve number 9 and dysfunction signs. So the most appropriate answer for this is nucleus ambiguous. While dorsomotor nucleus of vagus, it is concerned with parasympathetic supply to different viscera. While the hypoglossal nerve nucleus, it is supposed to supply the muscles of tongue and also few infrared muscles through the ansa cervicalis. The third MCQ for this session reads as, a 3-year-old newborn presents with difficulty in swallowing, weak cry and episodes of choking during feeds. On examination, the baby has absent gag reflex, loss of taste from posterior one-third of tongue, reduced parotid salivation. Laryngoscopy shows normal vocal cord movement but poor elevation of the pharynx during swallowing. Which pharyngeal arch is most likely affected? The choices are first, second, third and fourth pharyngeal arch. Our correct answer is third pharyngeal arch. Why not first? Because we know that the first pharyngeal arch is the defects regarding first pharyngeal arch includes micronathia and ear ossicle defects. There is no loss of gag reflex. Here a question arises, what is gag reflex? Gag reflex is a protective reflex. Whenever some foreign hand or foreign touch stimulates the pharynx, then there is a protective phenomenon. The patient presents with a gag phenomenon, right? But this is absent if there is loss of sensations to the pharynx, and that is because of glossopharyngeal nerve. Our correct answer is third pharyngeal arch, because the nerve of third pharyngeal arch is glossopharyngeal nerve. Second pharyngeal arch, on the other hand, affects the muscles of facial expressions. And the fourth pharyngeal arch, it causes hoarseness of voice. That is true, right? Because it supplies cranial through the cranial nerve number 10. So that was discussion regarding our third MCQ for today's list. We come to the fourth MCQ. It is a simpler one, a histology question. The hard palate is lined by which type of epithelium? The choices are stratified squamous non-keratinized, stratified squamous keratinized, simple cuboidal, and pseudo-stratified ciliated columnar epithelium. The answer is stratified squamous keratinized epithelium, non-keratinized epithelium. Stratified squamous non-keratinized or stratified squamous keratinized. The answer is keratinized epithelium, because the hard palate mucosa has a mechanical pressure while masticating hard foods. It requires a mechanical pressure. Hence, it is lined by epithelium just like the skin. The skin is lined by stratified squamous keratinized epithelium. Likewise, the hard palate mucosa is also lined by stratified squamous epithelium. We know that the simple cuboidal epithelium lines the GI tract, while the pseudo-stratified ciliated epithelium lines the respiratory passage. Let us also complete the discussion regarding next type of epithelium on the nasal surface of soft palate. There are four choices: stratified squamous non-keratinized, pseudo-stratified ciliated columnar, simple columnar, and stratified cuboidal. Our answer is B, that is pseudo-stratified columnar ciliated. The soft palate has a nasal surface and an oral surface. We already explained that the oral epithelium is stratified squamous non-keratinized epithelium, while the nasal surface is lined by respiratory epithelium, and the respiratory epithelium is pseudo-stratified columnar ciliated with goblet cells. That is the perfect description of the respiratory epithelium. Let us continue with discussion of the question number 6. There is a picture showing intrinsic muscles of hand, and there is a yellow. We have to identify the structure labeled D, and this structure is definitely lumbricals. They have asked actions of the muscles. The choices are A, lumbrical muscle, it flexes metacarpophalangeal joint, extends proximal and distal interphalangeal joint. That is the correct answer. Dorsal interossea, on the other hand, they are concerned with abduction of fingers. Palmar interossea are concerned with adduction of fingers, while flexor digitorum superficialis muscle flexes the proximal interphalangeal joint. Why the answer is D? Because it is radially present. All the lumbricals are inserted radially in each finger. Secondly, the lumbrical muscles, they represent a worm-like structure. So it is worm-like in appearance, right? And hence the choice is lumbricals. The actions are they flex the metacarpophalangeal joint and extends the proximal interphalangeal joint. A third point in support is their origin. The muscle originates from tendons of flexor digitorum profundus muscle, right? We focus on next MCQ, that is MCQ number 7. A patient with a hypoglossal nerve lesion is asked to protrude the tongue. The tongue deviates to the right side. We have to name the muscle which is paralyzed. The four choices are left genioglossus, right genioglossus, left hyoglossus, right styloglossus. Our answer is right genioglossus muscle. Why so? We should know the action of each intrinsic muscle and extrinsic muscle of tongue. The extrinsic muscles of tongue, for example, genioglossus, it arises from the upper genial tubercle of mandible and inserts onto the inferior surface of tongue. So if we see the presentation of the muscle, it protrudes and it causes retraction of the protruded tongue. So that is the chief action of the muscle, and hence our choice is that when right genioglossus is paralyzed, it becomes weak and hence the tongue deviates to the right side. So the answer should be right genioglossus muscle. The next MCQ in our sequence is posterior one-third of tongue develops from which pharyngeal arch? We know that during embryonic life, during 4 to 8 week of intrauterine life, there is formation of some elevations around the neck. These elevations are having core made up of mesoderm, covering made up of ectoderm, and lining made up of endoderm, and the structures collectively are called as pharyngeal apparatus. There are 4 choices. Posterior one-third of tongue develops from first, second, third, or fourth pharyngeal arch. Let us see. The first pharyngeal arch gives rise to anterior two-thirds of tongue, while the second pharyngeal arch is responsible for development of tuberculum impar, that is questionable embryologically, while the third arch and the fourth arch, they conjointly they are concerned with development of mucosa of posterior one-third of tongue. The most correct answer in this case, posterior one-third develops from the upper part of the hypobranchial eminence, and this hypobranchial eminence develops from third and fourth pouch. Let us continue our discussions. Our next MCQ, that is number 9. The truncus arteriosus normally divides into aorta and pulmonary trunk due to the formation of, the choices are septum primum, aorticopulmonary septum, endocardial cushions, and interventricular septum. We know that the primitive heart tube develops in the cardiogenic area, and in this cardiogenic area, the heart tube consists of different sections or saculations as such. The truncus arteriosus, the bulbus cordis, the primitive ventricle, the primitive atrium, and sinus venosus. These are parts of the developing heart tube. The truncus arteriosus part is responsible for development of aorta and pulmonary trunk. There is a spiral septum which vertically divides the truncus arteriosus into two parts, aortic and pulmonary. So our best choice is aorticopulmonary septum or spiral septum, that is answer number B. On the other hand, the septum primum and interventricular septum, they are concerned with development of septums of the heart, जैसे interatrial septum and interventricular septums, while endocardial cushions, they are responsible for development of the smooth portion of the left atrium. We come to the next MCQ. Which aortic arch gives rise to left recurrent laryngeal nerve loop? For this, we should know the different arteries and different nerves derived from the pharyngeal arches. The arch of the nerve of the first arch is mandibular nerve. The nerve of second arch is facial nerve. The nerve for third arch is glossopharyngeal nerve. The nerve for fourth arch is superior laryngeal nerve, and the nerve for sixth arch is recurrent laryngeal nerve. So recurrent laryngeal nerve is a nerve of sixth arch, right? On the other hand, the aortic arch, these are arteries present within the mesodermal core of each pharyngeal arch. They are called as aortic arches. Arch of aorta is a adult structure, while aortic arches are primitive structures. So the answer is sixth arch, because the sixth arch gives rise to two structures. On the nervous element is recurrent laryngeal nerve, and the arterial element is on the fourth arch. On the right side, there is subclavian artery. On the left side, there is arch of aorta. As I have mentioned, arch of aorta is different and aortic arches are different, while the sixth arch on each side is responsible for development of pulmonary arteries. So the pulmonary arteries, they are derived from the sixth arch. So finally, our answer is sixth arch, that is D. Lastly in the session, failure of neural crest cell migration in cardiac development leads to all except, means there is some relation between migration of neural crest cell and development of the heart. The neural crest cells, as we know, they are concerned with many events. For example, saculations, septations, development of cardiogenic areas, right? The choices given in our Question: are tetralogy of Fallot, persistent truncus arteriosus, transposition of great arteries, and atrial septal defect? The answer is D, atrial septal defect. Reason: the atria develop from a series of septums called as interatrial septum, septum primum, the septum secundum, and the septum spurium. All of them, they have their role in formation of the definitive atrial septum. And if there is a atrial septum defect, it is because of this septum and it is not because of migration of neural crest cells. The neural cells cell migration, if it is defective, it may be responsible for other congenital anomalies of heart such as tetralogy of Fallot or persistent truncus arteriosus or transposition of great arteries, but not atrial septal defect. So our MCQ is except, exception में atrial septal defect should be the right answer. Thank you very much.